Good afternoon, everyone. My name is Arpit Gupta, and I am working as an assistant professor in Rama Institute of Pharmacy, Rama University, Kanpur. And I am going to deliver my lecture on the topic toxicity and different types of toxicity in the field of pharmacology. Now, the basic introduction about the contents of my slides, that are the introduction of toxicities, different types of toxicities such as subacute toxicities, acute toxicity, and chronic toxicity. Talking about the introduction part of the presentation, but what is toxicity and who is the father of toxicity? Toxicity defined as the level and the study of different poison concerned with the different xenobiotics compounds and that are affecting on the living organisms, and they may damage their organs or cells. Father of toxicology is Paracelsus, is a scientist that is called as the father of toxicology. He have studies various deep research in the field of toxicology and differentiate the terms of pharmacology and pharmacology in terms of different dose variations and all interaction mechanisms. Toxicity is the effect that occurs too much of a drug accumulate in the bloodstream. That means that if we are taking the dose in a limited amount or in the particular amount that is not toxic to the body and showing its pharmacological effect, then we when call that is a pharmacological effect, and if the dose exceeds their limit, that is called as toxicology. This would be either overdose. Overdose means that if we are taking the dose in a very large amount, such as prescribed in the terms of OD, BD, TDS, and we are taking in the large amount in the body and extending the daily dose, that is called as toxicology. The degree of harmful varies depending upon the drug and its effect. The degree of the dose depend on the bearing dose that we are taking large amount of dose. After that, this is a basic definition of toxicology. Toxicology is the scientific study of adverse effect that occurs in the living organism. Talking about the adverse effect, we should know about the difference between the side effects and adverse effect, and also we should know about the drug and medicine. What is the basic difference between a drug and medicine? If we are talking about the difference between the drug and medicines, then drug is any substance. Drug is any substance that is not showing that therapeutic effect in particular disease, but in case of medicine, medicine is pretended for any single type of disease, such as if we are using the medicine in case of antifungals, antivirals, antimalarial, antiparasites, then it is for single specific use, but drug is not for specific use. And second difference in that, drug is for approximately quantity and not given as a accurate quantity, that we are using the medicines in the form of 250 mg, 30 mg, 500 mg or 650 mg, and drugs are not in the proper quantity and not in the proper dose and amount. After that, we are observing the reporting symptoms such as mechanism, detection, treatment of toxic substances in case of toxicology. Talking about the statement that is very important, that poison is in everything. Poison is in everything and nothing is without poison. Only the dose decides either it is drug or poison. That poison is everything. Everything is poison and every drug is made up of poison. But if we are using it in the accurate quantity, then it is called as drug. But if we are reaching or extending its amount, then it is called as poison. This is the basic difference between the drug and the poison. That statement is given by Paracelsus, the pharmacologist and the scientist. In case of different types of toxicity such as acute toxicity, subacute and chronic toxicity. Now we talk about the different types of toxicity, that are acute toxicities, chronic toxicities and subacute toxicity. After that, we also talk about the OECD guidelines for the animals and for the pharmacology. OECD stands for Organization for Economic Cooperation and Development. Acute toxicity show its result in 24 hours and it is depend upon the 14 days of the duration. In between the 14 days, the acute toxicities works, and there are various symptoms that acute toxicity will show, such as tremors. If the patient is suffering or animal is suffering from acute toxicity, it shows the tremors, muscle spasm, that is the tightening in the muscles, lacrimation in the eyes region, salivation in the mouth. These are the basic symptoms of the acute toxicity. If animal or patient is suffering from this type of toxicities, that is called as acute toxicities. That duration is of 24 days, 24 hours, and in case of days, that it occurs within the 14 days. So these are the basic symptoms: tremors, muscle spasm, lacrimation, and salivation. And other symptoms are weight loss. In case of acute toxicity, that patient is suffering from the weight loss, diarrheal conditions, red skin or redness in the skin, swelling of the skin, burning sensations in the skin, severe pain, and convulsions, that is epilepsy or episodes. Epilepsy, convulsions, that is the same thing, and altered respiration. Either its respiration rate is increased or it is decreased, and also there is a difficulty in breathing or altering in the breathing. Second, talking about the second parameters of acute toxicity, that is the therapeutic index. It is a very important parameters for the assessment of acute toxicity, called as therapeutic index. Basically, therapeutic index is the ratio of LD50 and ED50. LD50 stands for lethal dose, that is a lethal dose, and ED50 stands for effective dose. Lethal dose is the lethal dose in which 50% of individuals are tested. Also in lethal dose, 50% population are going to be tested, and in case of effective dose, 50% of the population is going to be tested. But there is a basic difference between the lethal and effective dose. This lethal dose is for the 50% population is of the mortality rate. There is a basic difference between the mortality and morbidity. Mortality means there is a death rate, and morbidity means the birth rate. This is for mortality, and if the 50% of the population is decreased or death, that it is called as the lethal dose. Whereas in case of effective dose, there is a ratio of 50% population showing a pharmacological effect increase than the 50%. That is called as the effective dose. So LD50 and ED50 is the ratio for therapeutic index in case of acute toxicity. That is our first one. Next, talking about the subacute toxicities, its duration is of 28 days, 14 to 28 days. And after performing the acute toxicity, we perform the subacute toxicity and assessing their toxicity parameters inside the different organs of animal. If we are doing any project, if we are studying in the animal, then we are assessing the toxicological potential of subacute toxicity in liver, kidney, heart, lungs, spleen, pancreas, and these all organs. They are vital organs or any other organs. So subacute toxicity is also called as the repeated dose toxicity, and showing their adverse effect after the administration of dose after 28 days. This type of toxicity is called as subacute toxicity. So first one, our first toxicity is the acute toxicities. That range is about the 14 days, and second toxicity is subacute toxicity that extend or that delivers after the 28 days of administration of dose. Third toxicity is chronic toxicity. Chronic toxicity is the type of toxicity that occurs within the few months or also developed in the years. This is the long-term toxicities and multiple exposure to the drug. Common symptoms of the chronic toxicity includes confusion, ataxia, this is another condition, and third is the memory loss and poor concentration. Means neurological or neuropsychiatric behaviors parameters is related to this type of toxicity, that is called as chronic toxicity. So examples of chronic toxicity, such as we are taking the vapors of the concentration for a long time. In case of inhalational drug therapy or inhalational drug delivery system, we are taking certain acid vapors at longer time of exposure, then it will eventually leads to the chronic toxicity for a long period of time. After that, we are talking about the different toxicities in case of their duration or in case of their exposure time. So time for the different exposure, we are talking about the acute toxicity, subacute toxicity, and chronic toxicity. Acute toxicity lasts for the 14 days, whereas subacute toxicity lasts for 28 days, and chronic toxicity lasts for the 6 to 12 months. So it is a short-term acute condition of toxicities. This is a moderate condition, and this is the long-term condition for the toxicity. Basic toxicities are classified into the three types: acute, subacute, and chronic. Also subchronic is there, but we will not consider it. Next, OECD guidelines for toxicological studies. That is a very important guidelines in case of pharmacology field, and we talking about the assessment of the animals, animal house conditions, facilities, and tests and different protocols. Then it is a very important parameter that is called as OECD. The full form of the OECD is Organization for Economic Cooperation and Development. This is established in 1948, and it is a US finance Marshall Plan that gives the OECD guidelines for the performance of animals or experimental animals procedures. The basic object is to improve the economic and social well-being of people around the world. That is a totally social being about the world. And next is the sets international standards on a wide range of things. OECD guidelines also sets the international standards for the practical procedures for the pharmacological experiments on animals and all. After that, talking about different guidelines of the toxicity. Guidelines means that every toxicity is followed by different guidelines, and these guidelines have different procedure for performing any single procedure in the animals. So basic talking about the three types of toxicity, that is acute, subacute and chronic. The acute toxicity guidelines are OECD guideline 420, 423 and 425. This is also called as 14 days repeated dose toxicity. Means if we are administering the drug at a single times, then we are observing its parameters, its behavior parameters around 14 days. So this type of toxicity is called as acute toxicity. In case of subacute, this follows the guideline number 407, OECD guideline, that is the OECD guideline 407, that is following the subacute toxicity, and it is the repeated dose procedure for the 28 days on or 1 month. Chronic toxicity considers or follows the guideline number 452, and it is the repeated dose toxicity for 90 days. So this type of toxicity is called as OECD guidelines for performing the activity on the animals or experimental animals in case of pharmacology. Thank you.